But I just want to make you aware that in this center, the majority of persons that we treat are actually over the age of 50. So when we do our audits and our cohorts, the average age is actually about 56 to 57 years of age. So that means the majority are actually over 50. I also just wanted to pick up on the point, there was a study called Health of the Nation study. It was a few years ago now, but what it did show that although we mentioned, that percentage of over 18% in adults over the age of 25, when you reach 65 years of age, you're talking about a diabetes prevalence rate of over 40%. Okay, so the aging process is actually associated with an increase in the rate of diabetes. The other thing that we know about diabetes and diabetes care, it can get expensive, but it's even more expensive if you have a complication related to diabetes. Diabetes is actually the NCD that's actually the most expensive to treat, simply because when you get a complication in one place, you tend to get complications in all the other places in your body. So it's very, very expensive to treat. And so therefore what it means simply, I think in Barbados, from my perspective, is that we need to be very active in early diagnosis of people, picking up people who may have family histories, who may not be screening, picking up those who slip through the loopholes, as you said, who may have been told it's just a little high, but just change your diet and you'll be okay. And then of course, screening for complications and preventing complications. I'm very happy to see this group because, it's like BARB. When I was small, I thought it was BARB as the old people's club. Don't mean to be rude, but, I'm like just a few years shy of BARB now, but I will be joining. But what I see really is I see actually mature, experienced, and resourceful people. And so I'm happy that we have this partnership where we can benefit you, give you discounts in your prime when you actually deserve it. And I would like to say that we as staff members, we've already been in discussions as to how we create a little bit more of an opportunity for you where we can serve you with education, not necessarily in here, but maybe at your domicile, or we're all on Zoom now, so almost like we start like the BARB Diabetes Club or something like that, okay? Or BARB NCD Club. Mind you, persons who have diabetes, hypertension, high cholesterol, cardiovascular disease, they're all very intricately linked. And so you find when you have somebody with diabetes, they often have these other issues going on, or certainly are at risk of them. The other thing that I just want to, my other penny in the nickel, as I said, you're resourceful, and I see you also as people who are safeguarders of our nation. The Diabetes Foundation is very active in a program called the Childhood Obesity Prevention Coalition. We work very strongly with the Heart and Stroke Foundation and a number of other organizations in Barbados, because we have a problem going on here. Okay, our rates of childhood obesity are very high, and they've actually, I would say, they've probably increased about 7-fold since the 1980s in children. And what this means is that we're going to have persons growing up who are going to be more unwell in their adulthood. You're going to be getting higher rates of diabetes in people as they get older, because we're having these risk factors occurring at a much earlier age. And so therefore, I know I will be somehow looping some of y'all into that coalition, which is actually a very big coalition with many members. And I just see you as people who can, be a part of that process. We want all of Barbados to be a part of that process. And just to finish, I love this, BARB, bold, active, resourceful, and proud. I really, really, really like that. And that's kind of shaped or changed my youth perspective of BARB. And I would just like to propose that this is the kind of relationship that we want to have with you, a bold, active, a resourceful, and a proud relationship where we can actually do things, yes, for your organization, but also throughout Barbados and the wider Barbadian community as well. I also just want to say thank you for pointing out that you're a resource, not just for your members, but the wider community, because there are other NGOs that we are working with who are serving the elderly in communities. And that's something maybe we can look at as to how we either enhance maybe their programs or just work a bit more cooperatively. At the end of the day, I think we have lots of resources in Barbados, but the thing that's going to help take us forward as a nation is always partnerships and how we're able to, I would say, conquer and divide things rather than everybody trying to do the same thing in their little silo and not communicating.